Purdue students. My name is Sunny Ammerman, and I'm here today on behalf of the Rare Action Network, a rare disease grassroots advocacy group created by the National Organization for Rare Disorders, or NORD for short. I'm the volunteer state ambassador for Indiana and a rare disease patient as well. Today, I'm going to tell you all about what NORD is, what the Rare Action Network does, and also share my personal experiences as a patient. You'll learn what it's like to have a rare disease from my perspective and gain some insights into the patient's experience navigating the often overwhelming processes involved in obtaining medications from specialty pharmacies and getting insurance approval. My goal today is to help build some empathy for the patients you might one day be interacting with on the job, and also let you know about the great resources available to patients as well as industry from groups such as NORD. So, what is a rare disease anyway? In the US, any disease affecting fewer than 200,000 people is considered rare. There are more than 7,000 rare diseases affecting 25 to 30 million Americans. In other words, 1 in 10 Americans are living with a rare disease, and more than half of them are children. Besides dealing with their specific medical problems, people with rare diseases struggle to receive a proper diagnosis, find information, and gain treatment. The rarity of their conditions often makes medical research more difficult. The zebra is the official symbol of rare diseases, and you'll see a lot of zebra-themed imagery used by the rare disease community. This comes from the old adage, when you hear hoofbeats, think horses, not zebras, which encourages physicians to look for the most common diagnosis rather than sift through the many potential rare diseases out there. While this makes sense in most cases, this has the unintentional consequence of making it much harder for rare disease patients to obtain the right diagnosis and treatments in a timely manner. With roughly 1 in 10 Americans living with a rare disease, it's clearly not always going to be a horse. Sometimes it's a zebra. Why is it so difficult to find a doctor that can identify and diagnose a rare disease? Around 7.5 to 9% of people have a rare disease, and there are around 7,000 rare diseases. Out of 2,500 patients in a doctor's panel, around 225 will have a rare disease, but their chances of seeing any particular one is very small, less than 1%. It can take a long time for a zebra to get the correct diagnosis. Take a look at this map created by NORD, which details a typical patient's journey towards a diagnosis. About 1 in 13 people are currently living with an undiagnosed condition. Typically, it takes 5 years or longer for someone with a suspected rare disease to receive a correct diagnosis, with patients visiting numerous physicians along the way. It starts with the patient taking note of their symptoms, which leads them to their first visit to a primary care physician and initial testing, blood work, x-rays, etc. Then the patient might take what they've learned from those tests and apply them to some online research. Eventually, they'll have their first visit with a specialist. That specialist might only have a suspected diagnosis or no diagnosis at all. The patient might then begin treatment of their symptoms, but not the root cause. This can go on for quite some time. The patient might seek a second opinion from another specialist or find themselves in a long cycle of specialist referrals while they continue to try and pin down the root cause of their symptoms. From here, the patient might need genetic testing, unless they're lucky enough to receive a diagnosis. If a diagnosis is still elusive, a patient might seek genetic testing. Sometimes a patient might have to undergo multiple tests before the results lead to a correct diagnosis. Once diagnosed, the first thing a patient typically does is turn to the internet for more information on treatments and available resources. If necessary, they may begin genetic counseling. Finally, the patient will discover the amazing support from the rare disease community. There are numerous support groups available online and organizations such as NORD which offer resources and advocacy which helps improve the lives of rare disease patients. A few fun facts about me. Not only am I a rare disease patient and activist, but I'm an artist as well. I enjoy playing D&D with my friends, and I'm a virtual reality enthusiast. I also very clearly like video editing. I was born with a rare birth defect called septo-optic dysplasia, which caused optic nerve hypoplasia and panhypopituitarism, and I'm missing the septum pellucidum, a thin membrane found in the midline of the brain. Septo-optic dysplasia is seen in about 1 in 50,000 births, and only 30% of those diagnosed have all 3 indicators needed for the diagnosis. I am one of the lucky 30%. Due to the optic nerve hypoplasia, I am completely blind in both peripherals, and what vision I do have is worse than that of a senior citizen. I have double nystagmus, which causes my eyes to twitch rapidly and in different directions. This makes it difficult for my eyes to focus, so headaches from eye strain are a common issue for me if I don't take measures to alleviate this in the form of accessibility features such as larger text or text-to-speech tools. Due to the loss of peripheral vision, I have special glasses with Chadwick lenses, which are designed to expand my field of view in a similar way to how side view mirrors on vehicles assist drivers. This helps increase the chance that I might see hazards which I might otherwise miss entirely.
So that basically is a optic nerve hypoplasia, underdevelopment of the optic nerve. Okay. And what we're seeing, we look over here, we see the nerve head. Now we're going to check the macular fovea area, which is in this circle on the scan. And what we're looking here on the green part, there's the macula of the eye. It's still formed there. It looks reasonably good. But the problem is this nerve is only less than half the size it should be, and it doesn't have all that additional nerve fiber coming into there to transmit back and forth to the brain. So it's what we call optic nerve hypoplasia, underdevelopment of the optic nerve, and it can be associated with things like an underdevelopment of the tissue in the pituitary and the sulca and these areas in the brain, causing other interlogical changes and problems for
patients.
Like
the panhypopituitarism that I've got.
That's right. And we come over here, and that affects growth, and they often have to have growth hormones. Now here's the foveal macular area here, which looks reasonably good. The nerve is pale and slightly atrophic and underdeveloped, and that's a much smaller nerve than in the other eye, and so we lose some acuity from that. It can be quite varied. Some will have profound loss from this, some will have a moderate loss. The fovea itself, it's developed reasonable, but it doesn't have the amount of nerve fiber to carry the signal to the brain to get the same quality. And these traditionally cause a loss of the outer half of the visual field in both eyes, which you've experienced, and that's why I use the field expanders on the outside of the glasses to give you more field.
Yeah.
Okay?
Awesome. Thank you. Panhypopituitarism means my pituitary gland doesn't produce the hormones necessary to perform some basic day-to-day bodily functions. This has caused hypothyroidism, hypogonadism, adult growth hormone deficiency, and secondary adrenal insufficiency, which can lead to a potentially fatal complication known as an adrenal crisis. I have to take hormones in the form of pills 3 times a day and a daily injection to help sustain my body and keep me going. Treatment isn't a cure, and it's still not perfect. The hormones I take are synthetic and on a schedule, which doesn't exactly mimic the way that hormones are naturally secreted by normally healthy people throughout the day. As a result, I sometimes experience often debilitating symptoms like muscle weakness, fatigue, minor tremors, and brain fog, among others. Due to the pituitary issues, I also have a litany of other metabolic conditions such as insulin resistance and some vitamin deficiencies. When I was born, newborn screening wasn't as robust as it is today, so my parents were completely unaware of my condition until it became very clear that I was not developing like my peers. I was also very frail looking and kept getting sick easily, missing a lot of school to recover from recurrent upper respiratory infections. When I was 13 years old, they took me to Riley Children's Hospital, where I was lucky to be seen by an endocrinologist who is familiar with my rare disease. He took one look at my twitching eyes and developmental delays and suspected my diagnosis right away. Tests confirmed that he was correct, and I was able to start treatment immediately. The medications improved my poor health and strengthened my frail body, and while I would never effectively finish puberty, I developed enough to get by. Growth hormone injections gave me the boost I needed to not be classified as a dwarf, and as soon as I reached that threshold, I begged my parents and doctor to let me stop taking the shots, as they had become quite painful. I didn't know it at the time, but I wasn't injecting in the right spots, and that was causing quite a bit of discomfort. I remained off the growth hormone shots until around the age of 23, when the endocrinologist I was seeing at the time informed me that it's also important for adults with growth hormone deficiency to take the shots, and I risked developing complications such as congestive heart failure without them. I agreed to take the shots again, and they really helped improve my overall quality of life. Unfortunately, not all endocrinologists agree on the importance of taking growth hormone as an adult, despite the very clear research supporting it. As a result, it can be difficult to obtain coverage of the medication, which we'll cover in the next segment. Even with the help provided by hormone replacement therapy, my body is still not strong enough, and a disability judge determined that I'm unable to obtain gainful employment. I still have some good days where I have plenty of strength and energy to dedicate to my advocacy efforts and other hobbies, but I have to be careful and pace myself so I don't cause a flare-up of symptoms that can leave me weakened for days or even weeks at a time. I'm lucky to have an excellent care team, which includes the very endocrinologist who first diagnosed me as a child, an eye specialist who is world-renowned and well-educated on my condition, a nutritionist who helps to coach me on diet and exercise, and a general practitioner for the acute stuff when it arises. I see my endocrinologist about once every 6 months to once a year, depending on how well I'm doing, and I check up with my eye specialist once a year as well. Since I'm on Medicaid, all of this quality care is covered at no cost to me, which I am extremely grateful for. I don't think I'd be able to afford the care that I need without it. As a rare disease patient, I am very passionate about ensuring that people like myself have adequate access to the treatments and quality care we need in order to live our best lives. Today, we have taken great strides to ensure that barriers to access to care are addressed, so that patients can obtain treatments regardless of the rarity of their conditions. This was not always the case. In the late 1970s and early 80s, patients and families living with rare diseases felt alone and forgotten. Very little was being done to study these diseases or develop treatments. Leaders of several rare disease patient organizations formed an ad hoc coalition to focus attention on this problem. That coalition became the National Organization for Rare Disorders and was instrumental in the Orphan Drug Act of 1983, which created financial incentives for the development of treatments for rare diseases. You might want to familiarize yourself with the term orphan drug, because you'll be hearing it a lot throughout this course. To help explain what an orphan drug is and dispel some common myths about them, here's a video produced by NORD's Rare Insights team. Here are the 5 myths about orphan drugs and the Orphan Drug Act. What is an orphan drug? Treatments for rare diseases, conditions affecting fewer than 200,000 Americans, are called orphan drugs because historically these conditions have been ignored or orphaned due to the small populations of people impacted by them. What is the Orphan Drug Act? To incentivize research and development into the treatments for rare diseases, the Orphan Drug Act was passed in 1983. The law provides 3 primary incentives to manufacturers: federal grants for research, a tax credit to defray the costs of clinical trials, and 7 years of market exclusivity for new orphan products or a new orphan indication of an existing FDA-approved product. Myth number 1. 7 of the 10 top-selling drugs in the United States are orphan drugs. These drugs have multiple indications and are not just sold as orphan drugs. This means they have been approved to treat multiple conditions, not just rare diseases. Therefore, their total sales figures are the sum of both their orphan and non-orphan indications. For example, Humira, which is frequently cited, has 12 different indications, only 4 of which are orphan. Of its $13.6 billion in total sales in 2016, only 3.8% were attributed to the 4 orphan indications. Myth number 2. Blockbuster drugs can be protected from competition by seeking an added orphan indication to an already approved drug, and the benefit of market exclusivity applies to all of the drug's indications. If a drug is already on the market and the company gains approval for an additional orphan indication, the benefit of 7 years exclusivity under the Orphan Drug Act applies only to the new orphan indication, not the entire drug. Myth number 3. Orphan drugs are a major contributor to rising drug and healthcare costs. Of the total drug sales of $450 billion in the U.S. in 2016, only 7.9% were for orphan indications of approved drugs. Myth number 4. Specialty drugs are the same as orphan drugs. The two are not the same. Specialty drugs are defined by special requirements, i.e. for storage or handling, how they are administered, i.e. by a professional or as an infusion, and how much they cost. While an orphan drug may be a specialty drug, not all specialty drugs are orphans. Myth number 5. The benefits of the Orphan Drug Act distort the marketplace and bias research away from diseases affecting more people. Studying rare diseases has led to an increased understanding of the body's biochemical pathways and to major breakthroughs in discovering how our genes interact with other factors to cause disease. The Orphan Drug Act has helped drive innovation in many fields within medicine, including cancer treatment. Thanks to the implementation of the Orphan Drug Act, lives of rare disease patients all across the U.S. have greatly improved, but there is still a lot of work to do. Many patients still struggle to obtain a correct diagnosis in a timely manner, and our healthcare system has many shortcomings affecting rare disease patients which need to be addressed. I'll share more about NORD's current policy initiatives and other advocacy efforts later on in this lecture. I assume many of you taking this class expect to eventually work as pharmacists, and you may find yourselves working for a specialty pharmacy. Specialty pharmacies handle many orphan drugs and other medications that are high cost or require special handling, such as temperature control. Many insurance companies require patients to use a specific specialty pharmacy, so patients themselves often don't have a choice in where their medications come from. Depending on the quality of customer service these pharmacies provide, it can be a pretty frustrating experience for many rare disease patients. In the interest of sharing some empathetic insight into what it's like for patients navigating this often infuriating system, I'm going to share my own experiences dealing with them. Please keep in mind that what I'm about to share contains a lot of my personal opinions as a rare disease patient and are not intended as statements from NORD or the Rare Action Network. I mentioned in the last segment that when I was about 23 years old, my endocrinologist convinced me to start taking growth hormone shots again. At the time, I was on my dad's private insurance, which will remain unnamed because I'm about to share some pretty unflattering experiences I've had with them. Before I can talk about my experience with the specialty pharmacy, it's important to explain the process of obtaining approval from insurance companies to cover the medications, as the high cost of these specialty drugs can be astronomical. For example, the growth hormone injection that I was prescribed at the time cost around $1,300 for a 28-day supply. There is no way I would be able to pay for that out of pocket, so insurance coverage is absolutely necessary. The private insurance I was covered by at the time made me fight tooth and nail to get my shots covered. They denied coverage right away, as many insurance companies are known to do, but they still refused coverage even after my doctor filed an appeal. After weeks and weeks of playing phone tag to ensure the second appeal was processed in as timely a manner as possible, they denied me again and claimed that I would have to undergo more testing in order to prove that I really needed the medication. My endocrinologist was furious. The test they wanted me to do is time-consuming, difficult to facilitate, and stressful on the body, and he claimed that it was completely unnecessary to make me go through all of that, as my diagnosis is clear and birth defects like mine generally do not improve over time. I was in his office when I told him what the insurance company was demanding of me, and he instructed me to wait in the exam room while he made a phone call in his office down the hall. Even through the closed doors, I could hear him actually yelling at the insurance rep on the other end of the line. When he finally returned, he informed me that the shots would be covered, no further testing required. I don't know exactly what was said, but he certainly got through to them somehow that their red tape would not be tolerated. I was ecstatic and relieved, and expected no further complications to arise. Unfortunately, there would be more hoops to jump through. When I tried to fill my prescription at my local pharmacy, I was informed that my insurance would not cover it. When I called my insurance to inquire as to why that is, they told me that I had to order my shots from their preferred specialty pharmacy. This would have been nice to know before I tried filling the order at my local pharmacy, wasting my time as well as others. So I contacted the specialty pharmacy to order my medication. I had to create an account with the pharmacy, which was a little time-consuming but not unbearable. Once all of the paperwork was complete, we started on my order. When we got to the copay, my heart sank. My insurance company was still expecting me to pay $100 out of pocket for my medication every month. I simply could not afford to pay that. The pharmacist kindly informed me of financial assistance provided by the manufacturer of the growth hormone shot, so I thanked them for the information before canceling the order and reaching out to the manufacturer. I was starting to feel like I had a full-time secretary job at this point and wondered who I should contact about getting a raise. The manufacturer was able to provide me with the information I needed to apply for their financial assistance program, which I qualified for. It took some time, but eventually I had the entire cost of my medication covered, and I was able to order my first shipment. They even arranged for an injection training nurse to come to my house and show me how to use the pen injector device at no cost to me. I was so grateful. I really have nothing but kind things to say about the drug manufacturer for all of the help they provided and would continue to provide later on, as I'm about to share further complications with the insurance company yet again. Thanks to the growth hormone treatment, I benefited from a decrease in debilitating symptoms, had a new sense of vigor, and way better sleep. It was an absolute shock when about a year after approval, my insurance company suddenly denied coverage of my medication again, claiming that the prior authorization had expired and needed to be renewed. I had very little warning ahead of time, and it was clear that I would be missing necessary doses of my medication while we struggled yet again with their bureaucratic red tape. Again, they denied the first appeal. Time was running out, and so were the remaining doses that I had on hand. Frustrated, I reached out to the manufacturer's assistance program. They had given me a number to call if I ever experienced barriers to accessing my medication. My patient care advocate was absolutely awesome and helped me deal with the insurance company, so the burden of playing phone tag between the insurance company and my doctor's office wasn't entirely on my shoulders. She made the calls for me and checked in regularly to let me know how things were going. There was even a program specifically for providing patients with doses of medication they would otherwise miss while they fight for coverage from their insurance companies, which just goes to show how unfortunately commonplace this experience is. Considering withdrawal symptoms from missing growth hormone injections were supposedly quite uncomfortable, I did everything that I could to not put myself through that. Unfortunately, despite our best efforts, the delayed responses from the insurance company and apparent miscommunications between them and the manufacturer caused me to miss about a week of doses before the prior authorization was reapproved and my medication was covered once again. I would have to put up this fight again the following year, but I knew what to expect and made sure to get the appeals process started even before my coverage would expire. When I turned 26 and was no longer covered by my dad's insurance under the provisions in the Affordable Care Act, I qualified for Medicaid. Other than forcing me to change the growth hormone brand name, I had no issues obtaining coverage for my growth hormone shots under Medicaid. The entire cost was covered, except for $3, which seemed arbitrary but definitely adds up on the grand scheme of things. Either way, I'm able to afford that copay, so I didn't need to seek further financial assistance. Since switching to Medicaid a little over 5 years ago, I have not had to deal with denials once a year as I had under private insurance. Long story short, when you find yourself working in a pharmacy sometime in your future, please be patient when dealing with exacerbated clients. Navigating the coverage process can be exhausting, disheartening, and unnecessarily complicated. I've probably been a little short with my specialty pharmacy once or twice after dealing with my insurance company, and I hope sharing my experiences with them might help you understand why. Drug manufacturers often have assistance programs to help ease the financial burden on low-income patients. Sometimes the entire cost of the medication is covered. However, many of these programs rely on grants, which are limited. Once the grant money runs out, assistance may not be available. Since 1987, NORD has provided assistance programs to help patients obtain life-saving or life-sustaining medication they could not otherwise afford. These programs include medication, financial assistance with insurance premiums and copays, diagnostic testing assistance, and travel assistance for clinical trials or consultation with disease specialists. NORD assists rare disease patients in other ways as well. They have numerous support programs, such as the Caregiver Respite Program, which provides a much-needed break for caregivers of rare disease patients so they can have some much-deserved alone time to take care of other business or simply relax. There are also special programs related to the unique challenges faced by rare disease patients during the COVID-19 pandemic. The NORD COVID-19 Premium and Medical Relief Program is designed to provide eligible rare disease patients assistance with insurance premiums and limited medical expenses. Both programs are specifically for rare disease patients who have been directly impacted by the COVID-19 pandemic through job loss, reduced work hours, quarantine, etc. You can find information about all these programs and more by visiting rarediseases.org. More broadly, NORD helps the rare disease community by working diligently to ensure legislators are aware of our unique struggles and encouraging them to introduce and support legislation which would improve the lives of rare Americans. Currently, NORD is supporting a number of policy initiatives which you can find on their website. They keep an up-to-date list of current issues with all of the information you need to be well informed about them, as well as NORD's official statements regarding these issues. In 2015, NORD launched its State Report Card project with the goal of evaluating how effectively states are serving people with rare diseases. They receive letter grades based on how well certain issues are being addressed in each state. It's important to note, however, that these issues are not exhaustive. The issues covered in these report cards touch on several critical and relevant policy areas at the state level, but with each issue included, there are still many others that are capable of impacting the lives of rare disease patients. In order to reach more and more people and make a larger impact at the grassroots level, NORD established the Rare Action Network. The mission of the Rare Action Network, RAN, is to connect and empower a unified network of individuals and organizations with tools, training, and resources to become effective advocates for rare diseases through national and state-based initiatives across the United States. RAN is the nation's leading rare disease advocacy network working to improve the lives of 30 million Americans impacted by rare disease. RAN serves as a broad spectrum of stakeholders ranging from patients to their families, caregivers, and friends, from researchers to industry to physicians and academia. While working on both the national and state level, RAN filters information to help address issues of national concern and engage rare communities to take action through policy, awareness, and education initiatives in their state and local communities. As the state ambassador for Indiana, I help support the rare disease community by facilitating monthly virtual discussion groups over Zoom to connect rare disease patients all across our state with one another to talk about the issues we face. These discussion groups are important as rare disease patients can often feel isolated and misunderstood as the result of living with a rare disease, and finding that connection with others creates a sense of community that has a truly positive impact. I also work with my state and local representatives to raise awareness of the issues we face and legislation that addresses them. I've had the pleasure of speaking with our senators and congressional representatives to voice these concerns, and their willingness to listen has been very encouraging. One of RAN's key goals is to establish a Rare Disease Advisory Council, or RDAC, in each state. An RDAC is an advisory body providing a platform for the rare disease community to have a stronger voice in state government. RDACs address the needs of rare disease patients and families by giving stakeholders an opportunity to make recommendations to state leaders on critical issues including the need for increased awareness, diagnostic tools, access to affordable treatments, and cures. Indiana does not currently have an RDAC, but this is something that we would really like to establish, hopefully in the next legislative session. Anyone can help improve the lives of rare disease patients and their families by getting involved in programs such as NORD's Rare Action Network, which you can join for free at rareaction.org. Our state's specific RAN website is rarein.org. You can reach out to me personally via email at sunshine.ammerman@rareaction.org. You can also help support the rare disease community by raising awareness for rare disease issues that you're passionate about by making posts on social media and calling or emailing your state and local representatives and sharing your opinions on issues impacting the rare disease community. Your voice really does matter, and you can make a huge difference here. If you're not sure who your representatives are, RAN has an awesome tool on their website to help you find them. You can type in your state address to find your representatives, or simply browse all representatives by state. You can also visit the Take Action tab to use RAN's outreach tool to easily compose an email that will be sent to your representatives with all of the important info regarding each specific issue, which you can also edit to add a personal message about why the issue is so important to you. Once you fill out the form, all you have to do is click Submit and your message is sent. It really is that easy to make your voice heard. NORD has an advocacy program specifically for university students called Students for Rare. To assure a future where rare diseases are not overlooked in patient care, research, and drug development, NORD works with student organizations to facilitate opportunities for students to learn about rare diseases and the patient experiences. The purpose of Students for Rare is to reach the next generation of professionals, advocates, researchers, and medical professionals, and spread awareness and recognition of rare diseases, to establish professional relationships and partnerships, and to pursue future opportunities within the rare disease space. The ideal candidates include intelligent, passionate, self-starting undergraduate and graduate students. Together, they strive to spread awareness and recognition of rare diseases, to establish professional relationships and partnerships, and to pursue future opportunities within the rare disease space. Students for Rare unite students of all disciplines and use their skills to improve the lives of rare disease patients. Purdue does not currently have a chapter, and I highly encourage you all to consider applying to establish one. There are many great benefits for being involved in the Students for Rare program, and the requirements won't overburden your already full academic workload. All you have to do is host at least 3 campus events to promote rare disease awareness and education on campus, become a registered student group on campus, have a faculty advisor, have at least 4 student leaders, adhere to the NORD chapter constitution and bylaws, and submit an annual report summarizing the activities of the previous academic year. It's that simple and would have a huge impact for both your school and the lives of many rare disease patients your advocacy efforts would help to improve. I hope you'll all consider getting involved. Another great way to show your support for the rare disease community is to get involved in Rare Disease Day, which is held on the last day of February each year. The main objective of Rare Disease Day is to raise awareness amongst the general public and decision makers about rare diseases and their impact on patients' lives. There are so many ways you can get involved on this day. Rare disease advocates take to social media to post about their experiences as rare disease patients and caregivers using the Rare Disease Day hashtag to lift their voices and make themselves heard. NORD hosts Rare Disease Day events in each state through their Rare Action Network. The last couple of Rare Disease Days have been virtual due to the pandemic, but there used to be an annual in-person Rare Disease Day celebration inviting state and local legislators to attend, connect with, and voice their support for the rare disease community. You can celebrate Rare Disease Day on your own as well. Before I became a volunteer of NORD's Rare Action Network, I hosted a special Rare Disease Day livestream on my Twitch and YouTube channels, where I spent a few hours reading aloud the stories of rare disease patients shared on the Rare Disease Day website, and answer live questions about what it's like living with my rare disease as well. It's always a really fun and informative event, and I still continue to have these live streams every year as my own personal contribution to Rare Disease Day. Aside from hosting live streams or events, you could always simply make a post on social media voicing your support for the rare disease community, and consider adding a donation link to help raise money for a rare disease nonprofit. Also consider getting some clothing or accessories with zebra stripes on them and wear those on Rare Disease Day. Be sure to share a photo of your zebra fashion on social media with #ShowYourStripes and #RareDiseaseDay. You can learn more about Rare Disease Day and find even more ways to get involved at rarediseaseday.org. You can learn more about how industry leaders are engaging with the rare disease community by attending the NORD Rare Diseases and Orphan Products Breakthrough Summit, which is held every year. The Rare Diseases and Orphan Products Breakthrough Summit, or NORD Summit, is one of the largest multi-stakeholder events in the rare disease community. The 2-day summit brings together members of the rare disease community from across the globe, including rare disease experts and leaders from patient advocacy groups, government, industry, and academia, to share new insights, network in a positive and practical virtual environment, and discuss critical topics in the rare disease and orphan products field. It's being held virtually this year on Monday, October 18th and Tuesday, October 19th, 2021. Anyone is welcome to attend, and there are a select number of complimentary passes available to member organization leaders, Rare Action Network state leaders, as well as medical professional students. You can email events@rarediseases.org to request information about the complimentary passes. This would be an excellent educational opportunity, and I highly encourage all of you to consider attending. As pharmacy students, you have a very unique opportunity to help the rare disease community. I hope that you'll take what you learned from this course and carry it with you into your future careers. Share what you've learned with your colleagues and be a voice for those rare disease patients who might otherwise not be heard by those working in the industry. Thank you so much for your interest in learning more about rare diseases, and thank you, Inez and Amy, for making this course a reality. It really means so much to us.